Excellent. Can you hear me okay? Great. How's everybody doing? One more time. How's everybody doing? Good. Great. Thank you. My name's Jack Dillon. I'm one of the founders of a product called Thrive. So what is Thrive? It's a clinical remote patient monitoring solution suite that allows for the collection of data regardless of their disease state. What we like to say internally, though, is Thrive is the science behind your healthcare change. So before we get into what Thrive does, I want to talk a little bit about why we did this, which is the economic impact. Thrive focuses on NCDs, or non-communicable diseases, things like cancer, diabetes, chronic pain, list goes on. And there's a lot of statistics out there, and here's just one of them, 47 trillion over the next 2 decades in the management and the economic burden here. For chronic diseases and all of these NCDs, most of that cost, most of that burden comes through multiple patient encounters, readmissions, testing, the list goes on. And what Thrive aims to do, along with taking care of patients, as well as working and making the lives of the care team better, is to decrease the overall spend. So we all know the problems that exist in healthcare. They're in the media every single day, can't get away from it, right? Care teams are burdened, right? Burning out. Patients don't feel heard. Staffing costs are rising. Access is always difficult, right? And all of that translate into costs just going up, not down. With Thrive, we are gonna decrease the number of office visits, but make them more meaningful for patients, right? The focus of Thrive is to look at that time between your doctor visit, your hospital admission, so patients feel seen and heard. There's a lot of tools out there for remote patient monitoring, right? You can pick up your smartphone right now and download just about anything. But what makes Thrive different is that it's adaptable to any condition, any disease state, and it can be customized to any practice, provider, or health system. It provides the care team and the physicians a customized dashboard to see the metrics that are important to them or important to their patients. It integrates with any wearable or any platform, and it's got sophisticated back-end data analytics and benchmarking. So looking under the hood of what Thrive does, you can see the graphic here. Thrive is adaptable in that it can, we like to say, if you can respond to a text, you can use Thrive, right? It can go from that to complex patient conditions, right? It can be simple and short-term, meaning it can be for post-operative recovery, or it can manage a patient who has cancer, diabetes, and just had surgery, all in one suite. The clinical pathways can be set up based on what we've built, based on best practices in medicine from some of the best institutions across the country, or it can be tailored to what one provider wants to do within their office. And the patient documentation can get as sophisticated as a patient would like. Like I said, a text reply for their pain score, all the way down to documenting what they're doing throughout the course of a day. Currently, here are our pathways: diabetes, post-operative care, pain management, cancer care, cardiac and chronic respiratory monitoring, all big ticket diagnoses that hit our health system worldwide. For all stakeholders, the payers win, right? They can access already existing CPT codes for remote patient monitoring, and they can decrease costs through fewer patient visits, as well as hospital admissions. Clinicians have less clicks, right? And they have less to document because the patients are helping them do that for them. And they can also decrease the number of visits by monitoring the patients remotely. And the patients win because they can communicate and journal their condition. They can gain personal insights into things like their sleep habits, diet habits, and other things, but most of all, they'll feel heard. This is the wonderful team that has built Thrive. We have a wonderful CMO with 20 plus years of healthcare experience, myself, who's worked in the healthcare industry and continues to do so, working directly with hospitals and practices, a CFO who's established a software company, and a CTO who's built numerous healthcare-related applications. So what Thrive is looking for, let me go back there. What Thrive is looking for is $3 million in seed funding, and with that, we'll increase our sales and marketing. We'll work further on our development. We hope to secure 6 clients and practices throughout the course of the next year, with one of them being a large major health system, and improve our operations. Thank you.